What do procedures like the Bella Hadid cat-eye thread lift and PDO threads and the ponytail neck lift and forehead reduction all have in common? All of these procedures have simply gained significant popularity since the pandemic occurred because we've been sort of glued to social media and things like remote meetings and other avenues to be able to evaluate our face from unflattering angles, that unflattering light, with basically an infinite array of filters to make us look in real time how we want to look. And how in real life can we achieve the results that we can get digitally given all of these circumstances? Well, a series of novel procedures that are designed to help people to achieve these goals. So some of the procedures have stuck and some seem to be fizzling out, like threads and cat-eye thread lifts and things like that. As far as I'm seeing, as far as demand, the demand for procedures like that is going down. Other procedures like forehead reduction and buccal fat pad removal seem to be staying pretty steady. What do I think is the next up-and-coming trend of 2023? Stay tuned and find out. Hi, I'm Dr. Jonathan Zelken, a board-certified plastic surgeon, and I predict that the so-called early intervention facelift will be one of the top procedures of 2023 and beyond. So trends come and go. This is the way life is. We basically model ourselves after celebrities and other things like that. And if somebody's wearing bell-bottom jeans, we want to wear bell-bottom jeans. If it's trendy to do X, we do X. And when it comes to clothing and makeup, that's fine. That's dandy. When it comes to surgical optimization, we've got to be a lot more careful because surgery is permanent and scars are forever. So the decision to modify one's anatomy should not be taken lightly, and trendy surgical procedures should be taken very seriously. I find myself sort of at the forefront of innovation as far as developing and standing behind new techniques to help people achieve their goals. But I also have to struggle with the moral and ethical conundrums that sort of come with it. Am I doing the right thing for certain patients? Whoever decided to put a breast implant in a woman for the first time, I give them a lot of credit. That operation has stuck, and even though there are certain controversies as to the safety of breast implants, we all understand that it's a risky undertaking, but it can provide high levels of patient satisfaction for years to come. And so it should, not be taken lightly, but it's proven to be a success and safe. Now, as far as facial plastic surgery, the risks of these operations can be as great or greater than body plastic surgery, and especially for the surgeons offering them, there's less room for riskiness and less room for being maverick in terms of developing facial techniques. So when it comes to things like the cat-eye thread lift, there's brow lifts, lip lifts. Things like the lip lift are here to stay as far as I'm concerned. Buccal fat pad removal, forehead reduction. These are procedures that have been described for decades, but only more recently have found their way in the modern era in terms of being socially normal. The procedure that I've been asked for more and more, and I thought it was a me thing, but I think it's universal amongst plastic surgeons who focus on the face, is something called a facelift. Yeah, you've heard of it before. Facelift is nothing new. But when people seeking these facelifts are no longer grandparents and no longer parents, and indeed are college students or women and men in their 30s and 40s, then it does start to raise eyebrows as to whether or not we're doing the right thing. But the more I perform these procedures, the more I love the results, number one. And number two, the more I seem to understand where people are coming from, and I can celebrate the results for various reasons. So the so-called early intervention facelift, meaning a facelift on somebody who doesn't necessarily look like they need it, is a great operation that I am beginning to love and continuing to innovate. And I think it's going to be the next big thing of 2023 and beyond. Hopefully this will be a procedure that stays. What exactly is an early intervention facelift? Well, a lot of times if you visited a med spa or a plastic surgeon, you may have heard them smirking and saying the best way to prevent wrinkles is to never get them. And so men and women as early as their late teens and 20s start to get Botox to prevent wrinkle formation so that they don't have to correct or chase after something later in life. It's the same thing. We brush our teeth every morning and every night so we don't get cavities, because it's easier to prevent cavities from forming than to to treat them after the fact. So these same rationale will support the idea of doing facelifts in younger populations. In previous videos, we've talked about doing facelifts in men and women under 40 years old, and to this day, I love that operation, possibly more now than any other operation I perform. The results are very gratifying, and patient satisfaction levels remain very high. So why would we perform an early intervention facelift? Early intervention facelifts sort of start to diverge from a traditional facelift, be it a traditional SMAS facelift or a deep plane facelift, because our intentions are a little bit different. Rather than try to correct for aging and to rejuvenate and to reverse what we call basically radial settling or downward and inward migration of the soft tissues that creates wrinkles, what we're trying to do is prevent that from happening in the first place, or slightly correcting it and preventing it from continuing. Trying to prevent facial wrinkles at an early age, in my opinion, may be the best way to correct them later in life as well. Doing an early intervention facelift is truly designed to create an optimal facial appearance where certain anatomic features are not currently optimized. For example, an anterior trough deformity, or some people have marionette lines or even jowls at an early age. These age indiscriminate changes can be addressed, but there are also additional modifications with this procedure versus other ones. This procedure is truly designed to correct for future problems, like removing buccal fat pads if I believe that they're going to be an issue later on in life, dividing neck muscles in a thin patient where I imagine with time the neck muscles will show through a thin skin envelope. Things like this are designed to be clever strategies to cheat the aging process and provide patients the most optimal results throughout their glory years. As a side benefit to these procedures, I notice that the recovery time in younger patients tends to be less. I notice that satisfaction tends to be greater, and in theory, you get to enjoy youthful looks throughout your 30s, 40s, and 50s, rather than trying to get to it when it's too late and correct for something that is becoming more difficult to correct as your skin quality weakens with time. Things like gene therapy or anti-gravity therapies or interventions just don't exist. So other than saying stay out of the sun, lie down at all the time and use Retin-A and moisturizer every single day and night, realistically, we're all going to age gracefully with time. So while living your highest quality of life, a surgical intervention, as silly as it sounds in a young patient, does have a lot of merit. And if you or somebody you know is considering a facelift at an early age and your family or friends think you're crazy, you certainly deserve to be able to talk to somebody about it, and I'd be happy to talk to you about it further. Currently, my youngest patient is about 24 years old, and her result remains one of my favorites. So thank you so much for your time. I hope this helps.